Hello, I'm Kathy Fenter for the Breastfeeding Committee for Canada, and this is our call to action for the promotion, protection and support of breastfeeding through the Baby Friendly Initiative in Canada. Why invest in breastfeeding? Decades of research that we now have validate the importance of breastfeeding for optimizing the health of women, families and communities. The joint statement from Health Canada, the Canadian Pediatric Society, the Dietitians of Canada, and the Breastfeeding Committee for Canada in 2012 stated that breastfeeding exclusively for the first 6 months of life and sustained up to 2 years and beyond with appropriate complementary feeding is important for the nutrition, the immunological protection, the growth and development of infants and toddlers. So what does it look like in Canada? The breastfeeding rates in Canada see significant decreases from birth to 6 months. And this really highlights for us the opportunity for enhancing evidence-informed practices across the continuity of care. The majority of women in Canada choose to breastfeed, and our statistics show about 92% initiation. But one of the biggest barriers to successful breastfeeding is the healthcare system and the well-meaning but sometimes misinformed healthcare provider, perhaps inconsistent information and advice, and personal breastfeeding experiences, lack of knowledge or misinformation, in our general societal setup. So where you have social norms that support breastfeeding, it's definitely a lot easier for women to succeed in meeting their goals. We have facilities that show that at discharge from hospital, less than 75% exclusive breastfeeding rates, including medical indications. So when we have a look at the drop, we've got about a third of babies, or 36% of them, being supplemented on discharge from hospital. And by 6 months, it's dropped again to about 18% exclusivity at 6 months. So we can target our operations to deal with those drop-offs, being able to find how we can best support parents. The Canadian breastfeeding targets look at 75% exclusivity from birth to discharge, and that is the measure for designation for the Baby Friendly Initiative. We use 50% exclusivity at 6 months by 2025 as the target for our long-term breastfeeding support and outcomes. So what are the breastfeeding rates at your facility? What about your region? What influences your breastfeeding experiences for families in your area? We have interesting information collected across Canada, and it's when you look at Canadian outcomes, they very often reflect the outcomes for breastfeeding families in the rest of the industrialized countries. Here is some research that was collated by the Breastfeeding Committee for Canada for submission to the industrialized countries meetings at World Health Organization. And it shows initiation rates and exclusivity from birth to discharge in 2 timeframes, from 2015 to 2017, where our initiation rates showed about an 80% initiation rate, and increasing slightly to 2018, 2019 to 85.3%. And our exclusivity from birth to discharge shows a similar little increase from 55% to about 57.8% exclusivity in 2019. So there has been some increases. What we have got in Canada is some difficulty collecting data across all the provinces and territories. And you will see from this diagram, this graph, that we had a couple of provinces that we didn't have data for, and some of them submitted data a little after the survey was conducted. So, finding information that we can look at and compare equitably across our country is one of the challenges that implementing Baby Friendly tends to help with, because we are part of the quality improvement is to look at the statistics. So, when we are looking at improvements in breastfeeding exclusivity and duration rates, we can impose that on our health services. We can look at the continuity of care and see where the gaps might be. We know that initiation rate largely is influenced by the societal norms and the services, the prenatal information people get. And we're looking at hospital practices that's reflected in what's happening to parents when they leave hospital. Are babies being supplemented for medical reasons, or is there a large population that is being supplemented for non-medical reasons and often not parental informed decision? So why would we look at investing in care for families to help with breastfeeding when we have such competing priorities? For Canadians, breastfeeding optimizes so many vitally important long-term health outcomes. We're looking at clear evidence for decreased respiratory infections, diarrheal disease, obesity, type 2 diabetes, necrotizing enterocolitis, SIDS, and the data is promising for lower rates of leukemia and higher IQ for infants. When you look at maternal health, the clear evidence for reduced breast and ovarian cancers and positive impact on maternal mood, more and more strong evidence is coming out for the holistic, long-term, positive impact of breastfeeding on people. So, other considerations of environmental footprint and health equity and the healthcare system's cost savings are there as well. When we think about health equity, one of the things that Baby Friendly does is look at our statistics for disparities. So, we have the ability to target populations that are needing more support, and the cost savings that are involved when we are implementing Baby Friendly. The savings are great in many ways for which we have good evidence. We know that if we just looked at Ontario, what we would find is that breastfeeding to 6 months has the potential to decrease the risk of upper respiratory infections and otitis media, the top 2 conditions responsible for about 130,000 pediatric emergency room visits annually. So avoiding even half of these visits could save almost 9 million a year. So our population health vision, the vision for overall health and lifelong benefit to families, is the goal for the Baby Friendly Initiative and our public health role as a whole. The reduction in health disparities between populations is crucial. This is one way that we can impact the value, the quality of life of individuals throughout the lifespan. The goal of population health is to set priorities to reduce the inequities in life using universal and targeted approaches to improve those long-term outcomes and decrease the inequities. Creating community food security safety nets by improving breastfeeding and peer support, as well as family food security, identifying family food security needs. You're addressing the nutritional requirements of the individual child, and by doing so, strengthening the solid base for the nutrition for the family as well. By collecting and analyzing breastfeeding data based on populations and addressing any inequities, we are able to channel our funding, our energies, and our resources to really leveling the playing field for our families. Ways that we can channel and harvest our energies in the healthcare system where there are competing priorities is to think about BFI and its alignment with the quadruple aim of healthcare improvement. We all recognize that we need improved patient outcomes, We want to have the patient experience improved with consistent knowledge and support from healthcare professionals. We want to make sure our best practices are in place. And we want to lower the cost of healthcare for hospitalizations, trips to the doctor, and purchasing of equipment and breast milk substitutes. And we would really fundamentally like to ensure that our providers' experience is improved. This is such a worthwhile expenditure of energy and resources. And honestly, the outcome for retention of staff and job satisfaction is well known. So knowing these things and being able to superimpose the baby-friendly initiative with our other healthcare improvement strategies, we can definitely strengthen all of those strategies between each other. So, if we think about the impacts of the baby-friendly initiative, what we are looking at is increased early initiation of breastfeeding, and therefore impacting the exclusivity and the long-term breastfeeding outcomes. We want to make very sure that we have a cost-effective strategy that will reduce morbidity, it will improve the healthcare system, and it will foster community resilience. By empowering women, we're building a healthy society, and we're providing a framework for implementing best practice. The World Health Organization, when they published the Baby Friendly Hospital Initiative implementation guidance in 2018, identifies these points quite strongly on the basis of global experience. So we're not alone here in Canada, and when it comes to some of the issues that we have. So enhancing quality care through BFI, World Health Organization calls for facilities to strengthen quality improvement. And we know this is a fundamental principle when you're delivering any kind of healthcare, that we need to be sure that we're measuring the impact of that healthcare. We are looking to see how does BFI contribute to the Accreditation Canada HSO expectations. We know that there are many supporting outcomes. So we're looking at improved population health, outcome-focused strategy. We are measuring things. We're going back to make sure that our staff continue to be updated with their knowledge and skills, that we remain evidence-based in our practices, that we monitor our progress, that we continue to include the patients, the population that we serve in the strategy that we roll out to benefit them. We look at building good teams. It's a collaborative, interprofessional effort, and we're constantly trying to find ways to build the continuum of care. In Canada, Baby Friendly Initiative includes not only the hospital, but also the community, because we know how tightly the outcomes are dependent on good work between the two. We also know that we have to use our resources really efficiently. So, being able to streamline our efforts is key. The situation right now is that across Canada, less than 10% of hospitals and birthing centres are designated baby friendly. So, if you think about 21 hospitals across Canada, the effort required in reaching that designation is only compared then to the effort in sustaining that designation. So working in the healthcare system with all its continuing changes and competing demands, it's a great benefit to have something stable, a strategy that incorporates teamwork and that builds towards the best outcomes for families, something simple, easy, straightforward to follow that has known positive outcomes. Looking at the healthcare facilities in the community that are designated, we see that most of those facilities are designated in Ontario and in Quebec, and it's quite obvious that where BFI is mandated or set as a priority, in provinces and territories, there's an increased uptake and an improved services with much better breastfeeding rates as the long-term outcome. So our 10 steps to successful breastfeeding remain the same, basically, with the renewed BFI, Baby Friendly Hospital Initiative globally, but it's been re-examined and strengthened. In Canada, we've always included the International Code of Marketing of Breast Milk Substitutes as our 11th step to successful breastfeeding. And the global community have now addressed it in one of the top 2 critical management procedures. Step 1 and step 2 now includes the compliance with the code very strongly. Policies, very strong. Obviously, we need policies in order to guide practice and to demand accountability for that practice. And monitoring ongoing quality improvement, quality assurance, to make sure that the work that we're putting into implementing Baby Friendly is actually doing the job that we expect it to do. So making sure that the people that are rolling out this program, the staff that are implementing Baby Friendly, have the competencies that they need to support people to meet their infant feeding goals is part of that critical management procedures piece. We know that for facilities, education of staff is one of the expensive pieces of BFI, but it is absolutely imperative that we are giving them the opportunity to learn the right things. So when you look at the 10 steps today, you will see the critical management procedures, step 1 and 2, that includes 2 sub-steps in 1. And we're also looking at the key clinical practices, the practice points 3 to 10, which are the practical things. You know, the education of people prenatally, the important information about skin-to-skin contact at birth, non-separation, and all those familiar, stable underpinnings for good outcomes remain the same. What they have done is updated, obviously, the evidence base for each of the 10 steps. So some of the steps are stronger than others in evidence, and the documentation supporting that new vision for the 10 steps is very much available for everyone to check out. These documents are to be found on the Breastfeeding Committee for Canada website, as well as the full guideline for implementation of the International Code of Marketing of Breast Milk Substitutes. So, you know, if we think about why we're doing this, the health of our population truly depends on leadership and commitment to BFI. As a grassroots movement, BFI has great value, but the sustainability and the sustained positive outcomes depends on really strong leadership and commitment, and passing that commitment on from one leader, one group to the other, within facilities, within communities, within our country, is something we have to work very, very hard on. The nature of our country and the way that our healthcare system works is different from one province and territory to the other slightly. And so being able to work together at that community table to maintain the enthusiasm and the commitment remains a very important piece of what the BCC can bring in calling us all together. So, to our call of action. Remember, we want to protect, promote, and support breastfeeding through the implementation of our Baby Friendly initiative here in Canada. The following strategies will help us to do that. So, as an organization, commit to attaining BFI designation by incorporating the BFI into your strategic plan. Review and sign a letter of intent to work towards BFI designation and submit that to the BCC for national recognition. Monitor your progress towards your goals and report your achievements publicly. Commit to data collection as a facility, as a province or territory, and nationally. Seek support from local and national BFI and quality improvement experts, and celebrate your successes and strive for further improvement. BFI generally works towards building on our successes, building the positive, creating the tsunami that's going to achieve these goals. We need action and we need leadership and commitment to BFI to achieve our long-term objectives. Thank you. So at this point, I would suggest that if you have any questions, if you would like more information about the Baby Friendly Initiative or about the Breastfeeding Committee for Canada, if we can support you in any way as you begin your journey, not knowing perhaps what to do first, or if you're halfway through your journey and you need some re-energizing to continue your journey, or if you would like to just share your successes, then please do contact us. The website is there, and there is an email address there where you can get answers to those things. So good luck with your baby-friendly journey, and thank you.